Hi everyone, and thank you very much for joining me on drsue.ca. Today what I wanted to talk to you about are multivitamins. I get asked about multivitamins by my patients a lot. So what is the best type of multivitamin that a person should be taking? Is there one that's better than the other? What's in a multivitamin anyway? Well, let me tell you. So a multivitamin contains different quantities of vitamins, which are examples like vitamin A, vitamin C, many different types of vitamin B, vitamin D, and vitamin E. And then in addition, multivitamin may or may not contain different quantities of minerals. And minerals are nutrients that we need in smaller quantities that are also essential to our cellular functions. So examples of that would include iron, magnesium, things like that. I pulled a couple of multivitamins off my own shelf just to look at some of the differences. This one contains a range of different types of vitamins, those are the ones that we talked about, and then contains 4 or 5 different minerals. Now if you take this other one that I also have on my shelf, it also contains a similar range of vitamins, but it actually has a much wider range of minerals. So this one has some manganese and some other things that the first one didn't have. Then we have some that are targeted to different age groups. So this one is targeted towards people age 50 and older, primarily because it contains more vitamin D. But for all intents and purposes, most multivitamins don't contain enough vitamin D, and most people will need to take a vitamin D supplement on top of the multivitamin that they're already taking. Now, some people ask me, Dr. Sue, why eat a multivitamin at all? Well, the truth is that the food that we now have in our food supply is very processed, and it gets more processed year by year. And because of that, nutrients become less prominent in the food, and there's more fillers and empty calories and that sort of thing in our natural food supply. So the bottom line is that it's very difficult to get the amount of vitamins and minerals that we need without eating to excess in calories if we're going to try and get it all from our natural food supply. So in most cases, it makes sense to add a multivitamin in order to make sure that we get the nutrients that we need without having to eat to excess and gaining weight with empty calories. Now, in terms of which one, well, as I noted, there are some that are targeted towards the over 50 age group. There's some that are designed especially for kids, and there's some that are designed especially for pregnant women. Those are primarily directed towards increasing folate content, and women who are pregnant need more iron as well in most cases. There's also certain medical conditions where we have to be careful what type of multivitamin we use. An example of that would be kidney failure. Patients who have had weight loss surgery, in particular malabsorptive procedures like gastric bypass surgery, have very special requirements in terms of the vitamins and minerals that they need as well. So the bottom line is that it's really important to speak to your doctor about the vitamin that's best for you. Thanks very much for your time. Hope you have a great day. drsue.ca